20, and now it's time for The Doctor Is In. And this morning we're talking about conserving our healthcare dollars and MRIs for back pain. And joining us this morning is Dr. Ira Zunin. He's the medical director of the Mauna Kea o Malama Integrative Clinic. Good morning, Dr. Zunin, and thank you so much for joining us. I just wanted to show off this article yesterday that was in the paper, and it has a really big headline, and it says, it says, "Over-treated America, more medical care will not necessarily make you healthier, and in fact it might make you sicker." Now there's a lot reading about this and the shooting costs of healthcare and all of these tests, and do you agree that people are being over-treated?
Well, I agree that we're duplicating a lot of tests, and that's really driving up the cost of healthcare. You know, one principal reason is that doctors still don't have ready access to a patient's medical record, particularly when they've had care somewhere else, and to provide good care in the moment, they just repeat the test. There's also this whole issue of defensive medicine, where doctors are concerned about getting sued for malpractice, so that is driving medical decision-making rather than the good practice of good medicine, and we need to make this more efficient.
And there is an effort to link information between doctors, and that's sort of a new thing right now. What do you think should be done to make things more efficient in terms of health care?
Well, this issue of linking the records, electronic medical records, and then the ability for different hospitals, different doctors to talk to one another through those medical records. So all those tests, and also in emergency situations, those are available. On the defensive medicine side, tort reform is the answer.
And what about MRIs? You know, there have been lots of discussion on the appropriate use of MRIs for back pain especially. And if you've ever gotten an MRI, it's pretty expensive, isn't it?
It's really expensive, and it's more expensive than most of the other common radiological tests like X-rays, CAT scan, ultrasound. And for that reason, many people think that that's the best test. So patients will often come in and request an MRI at the first visit.
So when is the most appropriate time to get an MRI?
Well, Mahia, first, nothing's more important than a careful history and physical examination. Then you usually know what's going on. The majority of the time, the back pain can be determined just by the exam. And it's rarely appropriate to order an MRI at that first visit. The other thing is that there's a saying in medicine that you have to know what you're going to do with the answer to a test before you order it. So really the time to order an MRI is after you've made a good diagnosis, conservative care has failed, patient is really ready for surgery. That's the time. Otherwise, we may want to save those healthcare dollars.
It sounds like a patient really needs to be educated on these sorts of things, because if you go to a doctor and you say, I've got pain, and if your doctor prescribes an MRI, a lot of people will just get it, right?
Absolutely. So education is really sometimes the biggest component of a medical visit.
All right. Dr. Ira Zunin, the medical director of the Mauna Kea o Malama Integrative Clinic. He always joins us once a month for the Doctor Is In segment. Dr. Z, thank you so much for joining us.